Welcome to I don't know what to call this. Welcome to my first my first Substack live.
So,
Um, this is I guess learn something new today is the name of my Substack. My name is Anthony Milian, public historian. We're doing something a little bit different today, not necessarily history related. We have someone that I first met in Columbia, South Carolina, at a rally to stop an abortion bill that was going through in South Carolina. And I wanted to have more people on here. So this is Carrie Schaffner. She is the board president of the Palmetto State Abortion Fund. I got it right.
yeah.
Um, and so welcome. Thank you for coming. And tell people what you're about.
Yeah, so thank you for having me. Super excited to be here for your very first Substack Live. I'm board president with the Abortion Fund, and what we do is we help people access abortion care here in South Carolina, whether that is medication abortion or procedural abortion. A lot of the help that we provide is financial assistance, but we also offer logistical support. A lot of folks, unfortunately, are having to travel out of state to access their care these days. So sometimes that's plane tickets, Ubers, childcare, food, anything like that. When we first started in 2021, we just worked here in South Carolina, but we now have been able to expand and we serve South Carolina, Georgia, Alabama, and Mississippi. So we've been able to grow quite a bit and help out. South Carolina is always our primary focus,
Right.
especially with some of the legislation going on here, but helping out wherever we can.
Now, when you say growth, well, first of all, let's do a backtrack here. South Carolina, when people think about abortion, they don't think about South Carolina. People think about that's one of the states that is getting rid of reproductive access. What have you seen as somebody who's been in South Carolina for quite some time? I believe you grew up here. Is that correct?
I didn't, but I've been here for like almost 20 years.
Okay.
So,
So, how have you seen the progression? Because South Carolina always wasn't this regressive.
right.
What have you seen?
I've definitely, especially over the last, I would say, 6 years. I mean, really, since I think this is kind of what led up to the abortion fund being created, is this real push towards extremism, where it's no longer kind of there where we can find a middle ground. There's this growing population of folks who just have these really extreme ideas, not just of wanting to ban abortion, but of wanting to criminalize it, wanting to give people the death penalty. I mean, so I see that just growing more and more, where we can't even come to they're not even happy with the 6 week ban that they were finally able to pass, a 6 week ban. And that's not enough for them. And unfortunately, I just see that continuing to grow.
Now, what would you say is I mean, because I see where I live, there are there's one abortion clinic for both counties where I live,
Mhm.
and I see that there's people with ladders going trying to get over not really get over the fence, but shout at people
Yeah.
over the fence. And there are people there that are protecting them. The protecting the patients, excuse me. What is the toughest part of your job? Funding, finding people to what's the hardest part of your job?
Oh goodness. Right now I can tell you that the hardest part is staying up on legislation because they are pushing legislation through to restrict abortion access. I mean, faster and faster.
Mhm.
Um, that right now is really difficult. We've been really lucky that, as far as funding and stuff, we are completely volunteer program or volunteer nonprofit. We don't get grants and stuff, so we run completely on donations, and we've been very lucky to be able to keep up with that and to get donations and stuff. But yeah, battling some of these lies and stuff that come out. I mean, I know exactly who you're talking about. When you talk about the people on ladders, I'm very familiar with them. People on ladders and standing outside of clinics and yelling. We only have 3 abortion clinics in South Carolina for the whole state.
Right.
And so trying to I think also just keep people informed. There are so many people that think abortion is already banned in South Carolina. I talk to people on a regular basis who are like, I didn't even think we were doing abortions anymore. So I think keeping people educated when there's so much
Right.
misinformation, and there's, you have, again, the small group of extremists who are so loud and so well funded, that it's hard to fight that sometimes.
Right, right. And one thing that I wanted to ask, there's another thing that's happening right now when it comes to abortion, and that's they're trying to limit access to the abortion pill.
Mhm.
That's something that I've seen recently. I'm actually looking at an article right now from my local newspaper, and it's basically H4760. It's entitled as the Abortion Inducing Drugs Act, and it seeks to regulate two drugs, mifepristone and misoprostol.
Misoprostol, yeah.
Misoprostol. Okay, yeah, I completely messed up those names, and so basically these pills can and they're saying on the article that it could terminate pregnancy and they could be used to treat things like late miscarriages. And here's a quote. We urge lawmakers, this is from the policy consultant with the South Carolina Baptist Convention. We urge lawmakers to both protect the preborn and expectant mothers by promoting policies that safeguard the well being of women, encouraging holistic health care that values both mothers and children, and enacting legislation that prohibits the use of abortion inducing drugs in South Carolina. What is your that it sounds like a very hypocritical statement,
Right.
what he's saying. What would your rebuttal be to one, this law as somebody who helps people provide this care? And what would your rebuttal be to him, this pastor guy?
Yeah. Well, I think it's important to know, first of all, that in South Carolina, 84% of abortions that happen are through medication abortion.
Mm.
Um, so we know that by restricting this medication, which is their goal is to restrict it, their goal is to lower abortions in South Carolina, but all you're going to do is drive more people out of the state. We know that already. But also, like you mentioned, this is medication that is used for a myriad of other things, and multiple physicians have testified on this. So, mifepristone and misoprostol are used for thinning for IUD implantation. They're used for postpartum hemorrhaging. One doctor testified that one of the drugs that she uses for postpartum hemorrhaging, because of it's just, mifepristone is just available, she can easily dispense it to her patient. But if this were to be reclassified as a Schedule 4 drug, it's not something she can just have on hand, because this is like, like your oxycodones and stuff like that are Schedule 4 drugs. And it's not something that like a nurse practitioner would have access to. So she would actually have to leave her hemorrhaging patient, go to where this medication is kept, write a prescription for it, get the prescription for it, and then take it back to her patient, potentially delaying care for 15 to 20 minutes, she said.
Right.
And so it's not just about even the access for individuals that it creates a problem, but for physicians too, it creates a real problem. This medication is safe. It's been used for well over 20 years. There is well over 100 studies that attest to less than 1% of cases have any adverse effects to this medication. It's safer than Tylenol and ibuprofen and things like that. So this narrative of it's not safe and stuff is false. It's
Right,
just,
right.
I mean, I'm big, I like data. So we can show that through data that it's safe. And they've said so much on the House floor that the whole point of this bill, the 4760, is to decrease the number of abortions happening in South Carolina. But we
Mm.
also know that in states that have abortion bans, the number of abortions doesn't go down. It typically increases. When we see abortion rates go down is when we have systems in place that support people to have children. So when we see, good quality healthcare, good quality education, when there's maternal and paternal leave, access to, food and housing, those are things that help reduce the number of abortions the state sees,
Right.
not simply banning the medication. And there's a lot of criminalization parts of this that they talk about, because you can get abortion medication online through the mail. And that's one of the things they're trying to cut down on. But women know this, and they've known this for millennia, that if they want abortions, they will find ways to have abortions.
Right.
And so I would hope that anyone who truly cares about decreasing the number of abortions would take that information into consideration and maybe find other ways to address, if their concern is abortion, to address it versus just limiting access.
Right. Right. So, speaking of like these medications, I mean, as somebody who helps people find these medications and has to get a doctor's prescription, what are you hearing from the medical community in this state? From doctors, specifically gynecologists and
Mhm.
OBGYNs in regards to this?
Yeah, there's a lot of concern that we've heard personally from physicians, but also we've seen in testimony of the impact it would have for not just people seeking abortion care, but people. These medications are used for certain types of cancer treatments. They're used for treating blood sugar, Cushing's disease. I mean, I've even seen some alcohol disorder treatments use some of these drugs. So, I mean, a myriad of things. And so they're really concerned because it's a lot harder if you've ever been prescribed like a strong pain medication. They can be difficult to get your hands on. You have to have ID and all of this stuff. But then we talk to people who have like rheumatoid arthritis and who need some of these medications. Getting these medications refilled repeatedly and repeatedly can cause issues. And so there's a lot of concern about the impact it would have even on people who don't need it for abortion care. But
Right.
like I said, we know that people will continue to access these medications, whether it's legal or not. They will find ways. And, not that those ways aren't valid and stuff, but it's so much. I feel like it's so much safer for a community if they can go to the doctor and they can get a prescription, and they can access that medication easily versus having to go online and get it from somewhere where they're not maybe necessarily under a physician's guidance.
You're going out a little bit. I'm sorry.
Sorry.
You're good. um, so I mean, really, do you anticipate? I know there was a group. I believe her name was Dawn Bingham.
Mhm.
She was filing a lawsuit, basically stating that like this violated her right. Um, are you familiar with that by any chance?
Yeah, I'm familiar with Dong Bingham. Yeah.
Okay. Do you know whatever happened with that? Because I thought that was really interesting. And again, I'm not a lawyer, but I found it really interesting that they were using the same playbook that the right wing uses.
Yeah.
Like basically, hey, this is my religion and this is a violation of that. Um, so I thought that was do you know whatever happened with that particular piece of or lawsuit?
I don't know what happened. I can tell you that unfortunately, I don't believe Don Bingham is practicing in our state anymore. And we're seeing that as more legislation like this is passed, this that restricts abortion access and that really moves to criminalize physicians, we're seeing more and more leave the state because it's too much of a liability to practice. We have, I think the newest number is 17 counties in South Carolina that don't have an OBGYN practicing in their county. And so it's you would think again, this we know that doctors are leaving. Um, young people who come here to do, medical internships and who are going to medical school here they're not staying. They're leaving at a higher rate than they ever have before. And it's because again, it's a certain part of our government is just creating a really hostile environment where it's not worth the liability for them. They want to go practice somewhere where they have medical freedom to treat their patients and not have to worry about, well, if I prescribe this medicine and am I going to lose my license? Am I going to go to jail? And again, this is something we've seen in other states happening, that as these abortion bills get more and more restrictive, you have fewer and fewer people wanting to work there. And because physicians have to go through then attorneys to, if they're at the hospital and they want to give someone mifepristone, they have to talk to the attorney and stuff first. You're creating delays in care that can cause loss of infertility. It can cause a whole bunch of issues. And, we're unfortunately seeing women die because of it.
It's crazy. I mean,
Yeah.
so I don't really have any other questions, but what did you want to add to this discussion? If you wanted, people are watching this, at least 15 people are watching this. I mean, what do you have to say?
I think it's important to, I love facts, I love data. So, when you find yourself listening to these bills and these conversations, go and look at the data and look at the information that is out there that talks about the safety and efficacy of these medications. And I also, I have to do my organizer, board president thing of I would encourage you to reach out to your state senators if you're in South Carolina. The bill that you're talking about, 4760, is moving to the Senate now. It got its final House floor vote today, so it'll move to the Senate. And so I would encourage folks to reach out to their state senator and ask them not to move forward with this bill, not to hear it. And just, I think 6 weeks is enough for most people, is enough of a restriction. And, I always point out too that there were almost a dozen, I think, anti-abortion bills introduced into the legislative session this year. There were 3 or 4 at least introduced on anti-trans bathroom bills. And so we have all of this legislation coming out, and not a single one of them is going to do anything about our maternal mortality rate, our infant mortality rate. We've had an F rating from the March of Dimes since 2019. And said before that, I think the highest rating we had was a D. And none of these bills are going to address any of that. I don't think that a single bill was introduced this session that addresses those. And so I would encourage our senators also and our representatives, but to focus on legislation like that that will actually help the populations that they want to serve.
Right.
Abortion medication has been used for decades. It's safe. It's effective. It's safer than pregnancy and childbirth statistically.
Wow.
You know,
The thing
so
we're trying to preserve.
yeah, it's statistically safer. So yeah, I would encourage folks to just do the research. It's I love a Google moment, and
Right.
really really look into it and get involved. And I know it can feel, especially in a state like South Carolina, so defeating to constantly reach out to legislators and feel like it's not going anywhere, but it does make a difference. We see it, and so. I think right now that's the biggest thing they can do is just, stay involved and contact your representatives and senators.
Awesome. Well, thank you so much, Carrie. I really appreciate you. This is Carrie Schaefer. Did I pronounce your name?
Schaffner,
Schaffner.
you're
Okay,
close.
sorry. With the Palmetto State Abortion Fund. Thank you so much for joining us.
Yeah, thank you for having me. I appreciate it.
You're welcome.